The most commonly injured ones are the anterior cruciate ligament and the medial collateral ligament. And in layman's terms, people know them as ACL and the MCL. Very often at the time of the injury, you will be able to appreciate the fact that something has happened to your knee when the injury took place. The knee can be very painful, it can be swollen, you may find it difficult to walk, difficult to continue the sport, and if it's a significant injury, you may have swelling in your knee within a very short period of time. Most patients who have this injury can sometimes feel a feeling of something snapping in the joint or popping in the joint at the time of the injury, and then they find that they're unable to carry on doing what they were doing. I think the first important thing is to diagnose the injury and the fact that the injury is taking place. And for that, it might require a specialist or a physiotherapist to diagnose this special tests. But the injuries which are within the knee joint, such as the ACL injury, even though they heal, they don't actually heal to functional length. The ones that tend to heal reliably is the one on the inside of the knee called the medial collateral ligament, or MCL. There's a good 90% chance it will all heal up by itself, but it requires to be properly managed and braced. The outer side of the knee is less injured than the inner side of the knee, and the injuries tend to be more serious. But on an average, ligament injuries will take about 6 weeks to heal, during that time, you require supervised treatment. The exception to the rule is the cruciate, anterior cruciate ligament, because it doesn't heal reliably and often requires treatment if it continues to cause trouble. You can walk with a knee ligament damage. And in fact, if you can't walk, then it's likely that the injury is serious enough to have probably broken a bone or have a very serious injury. Minor ligament injuries, you can walk with them. And I think the important thing is, if after a week or two, if it's a minor injury and it's not settling down, it's important to seek help of your GP, physiotherapist, a specialist, so you know what's happening and why it's not settling down within the usual first few weeks after the injury. I would say surgery is generally not required unless the demands that's going to be placed on the knee is such that it's going to cause continuing problems to the knee. To be more precise, the medial ligament, the inside one of the knee, almost never needs an operation and heals reliably. The outer ligament, the lateral ligament, is actually like a cord and often doesn't heal well and requires treatment. The posterior cruciate ligament, the one at the back of the knee, very often doesn't require surgical treatment, but can be managed with conservative measures. But the anterior cruciate ligament, which is responsible for stability of your knee with twisting activities, very often does require treatment surgically, especially if it's causing symptoms with day-to-day activities and you want to play twisting sports, then it might require to be treated surgically, because very often it doesn't heal well enough with day-to-day activities or sport in many patients.